Hi there. You've clicked on the link on my participant information sheet and I'm going to read it out for you now. Study title: What are the experiences of neurodivergent adults of a short-term unstructured online peer support group? Researcher name Maurita Murphy. Brief summary of the research. I'm a psychotherapist within Cornwall Partnership NHS Foundation Trust, CFT, and also autistic and ADHD. As part of a project for my doctorate in clinical research, I'm inviting adults who are autistic and or ADHD, diagnosed or self-identifying, to participate in joining an online 8-session group I will be facilitating with around 7 other neurodivergent adults. The point of my research is to find out about your experiences of the group in a one-to-one chat when the group has finished. This information sheet will tell you more about the project. Why have I been invited to participate? Currently, there is very little support available in Cornwall for neurodivergent adults, despite national surveys reporting people wanting support and the government acknowledging this could be beneficial. Research evidence also suggests that peer or group support can have positive effects, such as an increase in confidence and well-being, with a sense of social support being gained from meaningful interaction with others whom people can relate to. To find out more about people's experience of peer support, this research is inviting you to be part of a small, short-term online group of neurodivergent adults. I will ask you about your experiences of being part of the group after it has finished. The group will be conducted once per week for 8 weeks, and each session will last 2 hours, including breaks. The content of the group sessions is to be based around free discussion of topics which can be agreed by the group members. The emphasis is on creating a supportive environment where everyone has an equal say. I will be inviting participants to be interviewed after the final group session to ask about their experiences. An important feature of this research will also be to disseminate results to the NHS Trust and other stakeholders. Please take time to consider the information carefully and to discuss it with family or friends if you wish, or to ask the researcher questions by emailing maurita.murphy@nhs.net. If you prefer to watch the video, then you've already clicked on the link. What would taking part involve? You'll be invited to have an individual video chat with the researcher, to ask any questions and to find out more about the project. It will be an opportunity for you to suggest what you might like to get out of the group sessions and what you might like them to include. The researcher will outline the probable ground rules of the group, such as participants keeping confidentiality for what they hear in the group and your right not to share anything personal you do not want to share. It will be necessary to discuss how you might look after yourself if others in the group should share something that's upsetting to you. You'll be encouraged to write this down as a safety plan. You'll be asked when you are available to attend a group, for example, what days and times are preferable to you. You'll be asked to give your consent to participate in the study by signing a consent form. This will include information such as how any data might be collected, stored and used, how you can withdraw from the study at any time, and who to contact should you have concerns. The consent form will be emailed to you to complete in your own time, to be returned before the group commences. You'll be invited to the first group session where ground rules will be discussed, along with individual preferences for the content of the group. Sessions will be run weekly for 8 weeks. After the final session, you'll be invited to attend an individual video interview to discuss your experiences of participating in the group. A list of possible topics to discuss will be emailed to you beforehand, such as what was positive, what was challenging for you, or whether you feel taking part has impacted you in any way. Interviews will be recorded and stored securely on an NHS secure server. Each conversation from the interviews will be transcribed and anonymised, ensuring it does not contain any personally identifiable information and stored securely on an NHS secure server. The researcher will analyse transcripts from all the interviews to look for themes of opinions, and some anonymous quotes from the transcripts will be included as part of writing up the findings from the study. In this research study, we will use information from you. We will only use information that we need for the research study. We will let very few people know your name or contact details, and only if they really need it for this study. Everyone involved in this study will keep your data safe and secure. We will also follow all privacy rules. At the end of the study, we will save some of the data in case we need to check it. We will make sure no one can work out who you are from the reports we write. Any personal data, such as your name, contact details and demographic information, will be stored securely and confidentially on an NHS server, secure server, and will be deleted immediately following completion of the study. What are the possible benefits of taking part? No specific benefits of attending the group can be guaranteed. However, participating in a group with people with similar lived experiences of being neurodivergent may be a positive experience. There is a small but growing research regarding people's experiences of participating in a peer support group, and this study will provide valuable contributions which will benefit the academic community. Results may benefit the broader society in promoting positive changes for neurodivergent people, as information will be shared with stakeholders such as service providers and organisations which support neurodivergent people. What are the possible disadvantages and risks of taking part? Whereas you will be in control of any information you choose to share within a group, we cannot control or predict what other participants choose to share and when. There is therefore a potential risk of feeling upset by hearing other people sharing personal experiences. It is important to think about how you would take care of yourself and what you would do. The researcher will discuss these potential issues in your individual video chat before the group commences and will help you draw up a safety plan for you to keep and refer to, outlining how you would care for yourself in such circumstances. For example, your preference may be to turn off your camera and microphone and take 5 minutes out, or you may choose to call a supportive friend or do something that you find soothing. A list of support organisations will be provided, and these can also be discussed prior to the commencement of the group. How will we use information about you? We will need to use information from you for this research project. This information will include your name and email address. People will use this information to do the research. People who do not need to know who you are will not be able to see your name or contact details. Your data will have a code number instead. The Cornwall Partnership NHS Foundation Trust is the sponsor of this research. Cornwall Partnership NHS Foundation Trust is responsible for looking after your information. We will not share your information related to this research project with any other organisations. Your data will not be shared outside of the UK. How will we use information about you after the study ends? Once we have finished the study, we will keep some of the data so we can check the results. We will write our reports in a way that no one can work out that you took part in the study. We will keep your study data for a maximum of 5 years. The study data will then be fully anonymised and securely archived or destroyed. What are your choices about how your information is used? You can stop being part of the study at any time without giving a reason, but we will keep information about you that we already have. You have the right to ask us to access, remove, change or delete data we hold about you for the purposes of the study. You can also object to our processing of your data. We might not always be able to do this if it means we cannot use your data to do the research. If so, we will tell you why we cannot do this. Where can you find out more information about how your information is used? You can find out more about how we use the information by asking one of the research team, by sending an email to maurita.murphy@nhs.net, or by ringing us on 07823 489 900, by emailing cpn-tr.info.gov@nhs.net, or writing to Cornwall Partnership NHS Foundation Trust, Information Governance Team, Suite 6, Carew House, Beacon Technology Park, Dunmere Road, Bodmin, PL31 2QN. You can find those emails and the address in the written version of the information sheet. Will I receive any payment for taking part? There will be no financial reward for taking part in this study. What will happen to the results of this study? The results of the research will be published on the university's repository Open Research Exeter and submitted to a peer-reviewed scientific journal. Results may also be presented at national conferences and also presented to commissioners and service providers in Cornwall in person or by email. Results will also be shared with members of Cornwall Autism Assessment Team who have offered advice in relation to this project. Participants can request a copy of the outcomes of this study. Who is organising and funding this study? The sponsor of this study is Cornwall Partnership NHS Foundation Trust. The research team consists of myself and a primary and secondary supervisor from the University of Exeter. Who has reviewed this study? The Health Research Authority has reviewed and approved this study. What to do if you're interested in taking part? Further information and contact details. If you wish to take part in this study or have any further questions, then please email me, Maurita, at maurita.murphy@nhs.net. If you are not happy with any aspect of this project and wish to complain, then please email my supervisor, Corday Smart, at c.a.smart2@exeter.ac.uk. You can also contact Cornwall Partnership Foundation NHS Trust Patient Advice and Liaison Service, PALS, by calling 01208 834 620 or emailing cft.patientexperiences@nhs.net, available Monday to Friday, 10 till 3:30pm. Additional contact: Dr. Anthony Walsh, Head of Research Governance, Ethics and Compliance, email a.walsh3@exeter.ac.uk, 01392 726621. Thank you for your interest in this project.